On the India Today Data Intelligence Unit trajectory tracker, I want to show you something very important. Now remember, this is the curve tracker. What it does is, in countries where the curve is going up in a steeper way, those are countries where COVID is spreading faster. And in countries where the curve is not going up at the same speed are countries which have been able to relatively flatten the curve. So which are the countries that have been able to flatten the curve? Hong Kong, then there is Singapore, then there is Japan. What's common about these countries? The fact that just as a societal norm, people tend to wear masks. 80–90% of the people tend to wear masks. Which are the countries where COVID-19 is spreading like wildfire? There is Spain, that's the orange. Then there is Italy. Then there is the United States. These are countries where masks are not worn. Therefore, there is emerging evidence now, lots of academic papers also coming out, which suggest that wearing some mask, even if it's a do-it-yourself home mask, is better than not wearing a mask at all. Should the Indian government and the ICMR, in light of this emerging evidence, review its position? And more importantly, should you start wearing masks? Should you start wearing masks? Rajveer Purohit joins us. He's the director of the Mount Sinai Hospital in the United States. Welcome, Dr. Purohit. Rajveer is with us. He's the CEO of Nirvana Being. I want to go across to Dr. Rajveer first. Dr. Rajveer, it's very clear from that trajectory tracker that countries that are at the bottom are typically countries where masks are being worn. However, can that by itself be meant to suggest that wearing masks is better? Why is the Center for Disease Control in the United States now accepting that they're reviewing their position, asking people to wear masks? And what implications does this have for India?
Well, I think there's a few concerns. The CDC will be changing its position about wearing masks. The concern, though, is that if everyone runs out right now to get a mask, those masks may not be available to healthcare providers and to doctors and nurses who are on the front lines. As it is now, we're almost getting to a shortage even for the providers to wear masks. That said, there's ways you can make a homemade masks, and there's ways you can get masks available for the population without compromising the ability for healthcare providers to get it. The concern really is that asymptomatic carriers of the disease may be shedding the viral particles into the air. And that's why the CDC is considering changing its position about masks. The masks are generally, I think, are proving to be protective for patients and for people out in the public. A few things that are also a little scary is that we're finding out that COVID may exist in air even longer than we think. There's been a study that recently came out that suggested that in hospital beds, COVID existed in the vent system even after the patient had been discharged from the hospital. So this is a really resistant, potentially a resistant viral particle. And by wearing masks, not only do you protect yourself, but you protect others if you're asymptomatic from getting it.
Now the problem here is, if everybody starts, those watching India Today can largely afford to go out and buy N95 masks. If everybody starts doing that, then those who really need it, those who are doctors, medical staff, they may not get it. And if you make a mask on your own, no one knows how good is it. Will it, if the virus is fine, will a do-it-yourself homemade mask actually be able to stop the virus from entering your system? Rajveer?
Yeah, hi, I'm sorry. We don't know that. So unfortunately, this is a novel virus, meaning there's much that we don't know about this virus and what the problems are with this and how well it transmits. That said, any kind of protection is better than no protection. So if you have a homemade masks, I think it's better than wearing no mask at all. It may not be as good as an N95 mask, and it may not be as good as a regular hospital mask. But my advice is for everyone going out in the public to wear a mask, even if it's a homemade mask.
Jaidar Gupta, now the critical question is, how should somebody try and make a mask at home? Will that help at all? Or will the particles just go into your body even if you've got some kind of a mask on?
Well, firstly, I want to make something very clear here. If you are in isolation and if you're distancing yourself socially, you don't need a mask. So while our country, India, is in a lockdown and people are supposed to be isolating themselves, you don't need a mask. The reason the WHO went on record and said, hey, you don't need masks is because people were just running out and buying the cheapest mask available, which is a surgical mask, and essentially taking this personal protective equipment away from doctors who actually need it the most. Now, in terms of what you do need, actually I was looking at a study by a Japanese group today that said that there's been a lot of talk about social distancing, 6 feet, 8 feet, we've heard it all, but now these guys are talking about 6 meters. It's the big stuff just flies out when you cough and when you sneeze, but there's little stuff as small as 0.1 micron that could be as far away as 6 meters when I'm talking even right now. So there's no way to protect yourself from that if you're wearing a homemade mask. Certainly something is better than nothing. But there's no homemade cloth mask that is going to protect you from like a 0.1 micron particle that's coming out of my mouth when I speak. And the study that I saw today was actually pretty scary. I mean, it again brings back the importance of being in well-ventilated spaces and also wearing a mask. I think it's absolutely imperative that once we come out of this lockdown and we get out to whatever the new normal is, you have to wear gloves and you have to wear an antiviral mask. Let's not take away surgical masks from our doctors. We need to wear an antiviral mask.
Very important points there. Jaidar Gupta, Rajbir Purohit, for joining us tonight. Thank you very much.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.